Now, health officials are monitoring a situation in Miami-Dade County where a high school student was diagnosed with measles. The CDC is currently tracking reports of measles outbreaks in other states, including 159 cases in Texas where a child died from the disease.
Now, we know a lot of you might have questions about what this means and if you should be worried about your kids. That's why we reached out to medical experts. We wanted to get some answers for you. They spoke with ABC Action News reporter Larissa Scott. Larissa is live in Tampa this morning. Good morning, Larissa. Parents are understandably concerned about this.
Hey, good morning, Dean and Andrew. Yes, they are, and federal and local health officials are closely monitoring these measles cases all across the country, and they tell me it's likely we could see more pop up in other states.
Measles is a highly contagious disease.
Measles is likely the most contagious disease.
That's Dr. Christian Brachot. He's a professor in USF's Infectious Disease Division and vice chairman of the board of directors of the Global Virus Network. He tells me measles is one of the most contagious diseases.
In fact, when you have one person infected, it can transmit the infection to up to 9 or 10 other people.
That's why he and other health experts are so concerned about the measles cases being reported around the country, including here in Florida and the outbreak over in Texas, where health officials announced a school-aged child who was not vaccinated and had no underlying health condition sadly died.
We understand that in these communities in Texas, up to 20% of the children didn't get the vaccine.
The medical concerns that come with the increase in vaccine hesitancy is something I've talked with health experts about for months.
The risk is an increase in these diseases, and then the effects are truly felt by the children who develop these illnesses.
Because of the fight over the COVID vaccines, now we're seeing a decrease in vaccination among young children from the childhood vaccines, which we all grew up with.
Health officials believe the majority of the children who've recently been infected with measles were unvaccinated.
It is very rare for you to actually see a child who received both doses of the vaccine to actually get measles.
The measles vaccine is given as part of the MMR vaccine, which provides protection against measles, mumps, and rubella. It's 97% effective. According to the CDC, symptoms usually begin 7 to 14 days after infection. Symptoms include a high fever, cough, runny nose, rash, and white spots inside the mouth. Doctors say most cases are mild, but measles can be dangerous for babies and young children.
With some neurologic complications, and eventually also 1 out of 1,000 the death.
Dr. Brachot tells me with the confirmed case now in Florida, it shows that spread is ongoing and further emphasizes the need for measles vaccinations. He understands, though, that parents may have legitimate concerns about vaccinations and encourages them to ask questions.
And in the case of measles, I really want to tell to the parents, there have been huge studies worldwide. We have been asking to experts from every country on every continent, and they all agree on the fact that the risk of the vaccine is extraordinarily low.
And experts stress there is no need to panic. They don't expect to see widespread cases at this point. However, if your child is not vaccinated for measles, they encourage you to talk to your doctor. I'm live in Tampa this morning. Larissa Scott, ABC Action News.